as you know, obviously you've got your primary exams, your first exams in anesthesia, and then your exit fellowship exams. So the stress was actually very much the primary exams. I can go in depth if you want me to, Sophie.
Yeah, explain what do you mean by that? Like, does it mean that not everyone sits for the exam at the same time? You have to decide if you're going to take the exam or not going to take the exam. What do you mean by that?
So there are 2 attempts per year for the primary exam. So your primary exam consists of 2 parts. So obviously, actually 3 parts. The first part is your MCQ based questions, and then you got your short answer questions, and you've got to pass those 2 papers first before you get invited for the viva. All right, and so then you get that. So once you pass your viva, you've passed your primary exams. And why I said it's so, I mean, it's stressful is because firstly, it's a 75% fail rate for the primary exams. So they kick off a lot of candidates at the start because the exit exams are quite straightforward and it's more clinical based, whereas the primary exams are very much science based. After that, they only give you 2 attempts. So after 2 attempts, so think of it as 2 lives. After 2 lives, you're pretty much done.
What do you mean by that?
So if you say you fail the first time, you get to repeat it again, but you have to repeat it within that 2 years. You cannot be doing just say, I've done my first year as a registrar, I've done my second year as a registrar, I can't attempt in my third year. In that, so just say you attempt it within the first year, then you fail. So you only have 6 months when the exam slot comes in again to attempt it for the second time. And then you fail the second time, then your 2 years is up. So you fail 2 attempts within that first 2 years, and then pretty much that's it. You're out of the program.